Hello and welcome to Opt to Thrive, episode 46, Preventative Health for Midlife Women, Screening Tests that actually make a difference.
Welcome to Opt to Thrive, your go-to podcast for women's wellness in midlife, designed to educate, support, and inspire you to live your very best life. And now your host, Dr. Karina Sims.
Well, hello and Happy New Year. The day that this podcast drops will be New Year's Day here in Australia, the start of a whole new, fresh year. So Happy New Year, everyone. I hope you have all had a lovely Christmas. For those of you who do celebrate, we certainly did. I was fortunate enough this year to have both my son and his girlfriend home for a few days, which was pretty special. They are both the same age as Arthur, who is our French backpacker with us this year picking figs. And we've just finished our first fig harvest, and the other backpacker who was here with Arthur went to see friends interstate for Christmas. So this year we only had the one. You might recall last year, if you listened last year, that we had two French backpackers that we took along for our family Christmas celebrations. And so it looks like it's becoming a thing. The family welcomed them with open arms, just like they welcomed me so many years ago. So easy and fun, and we had a great celebration. We do this really fun family white elephant Kris Kringle thing where everyone brings a wrapped gift and we all draw numbers. Then we go in order, and you either get to pick a gift from the pile or you steal someone else's. So it can get pretty interesting. If your gift gets stolen, you get to either re-pick from the pile or you steal someone else's. My husband this year had a sneaky little plan for his Kris Kringle. He lost his Yeti recently. If you haven't heard of a Yeti, it's one of these insulated water bottles that are pretty popular. So that was his Kris Kringle, and his plan was to just pick his own present when it was his turn, or if somebody else got it, he would steal it when it came to his turn. Now, Arthur, I think, had the same idea because he brought a beer pong game. Not just any beer pong game. It was actually quite an elaborate beer pong game in this massive box and wrapped very nicely. And funnily enough, both of those gifts were stolen several times. I wouldn't have picked it. And in fact, at one point, the family was trying to get Nan to steal the beer pong. Now, Nan's in her 90s. And to be quite honest, I don't think she was on her game this year because maybe in years past, she just may have stolen that beer pong. And in the end, both of them ended up with their own gifts. So it all worked out really well. And actually, I ended up with mine too, although that hadn't really been my plan. I was pretty happy with it. I actually took something that I wanted. I found a cherry pitter tool. I had never seen one of these before, and I was so thrilled by it. I thought there would be a few people who would be as thrilled as me to get this cherry pitter tool, but it turns out everybody else already had one. And I'd never actually seen one before. I couldn't wait to bring it home and see it in action. So I ended up stealing this gift when someone stole whatever. I can't even remember what I had picked, but someone stole mine. And I thought, well, you know what? I know I want that cherry pitter tool, so I'm going to take that. And when I got home that night, everyone in the house got a demonstration of how my little cherry pitter tool so neatly and cleanly removes all of the cherry pit. One day, I'm going to make a fresh cherry pie. One day. So yes, Christmas was lovely, and now the new year is upon us. And I love having a whole fresh year ahead. It's like having a blank slate, thinking about all the things I'm going to dream up, all the things I want to accomplish this year. But I also like reflecting on the year that's just gone. This was a particularly busy year for me. A year of change and growth. I retired from obstetrics, so stopped delivering babies last January, so it's been almost a year now. Opt to Thrive turned 1 in April, and I started the Midlife Reset in July. And I had a little peek at my app called Strong, where I keep track of all my weightlifting sessions, and it turns out I did 135 weightlifting sessions this year. I lifted a grand total of 650,124 kilos. So I've been pretty good to my muscles and bones this year. I've only just realized that reflecting back on the year, I haven't actually taken a holiday all year. Oops. I keep thinking that can't be right, but actually it is. I may just have to make up for that this year, I think. We'll see. I've already got a trip planned with the girls to Fiji for a swim holiday this winter. A couple of my girlfriends, as you probably have heard me say, are pretty serious swimmers, and they've actually organized us all to go on one of these swimming holidays where every day there's an organized ocean swim and everyone participates. I might be the last one to finish, but it sounds like so much fun, and it'll be towards the end of my least favorite winter weather, where I'll have had enough of leafless trees and lack of greenery and short cold days. And even though we get very little rain or gray skies here, what we get is more than enough for me. So I'm going to be very happy to take a holiday around that time during those crappy winter months. So I'm really looking forward to it. So starting off the year this year, and thinking of all of you out there, I thought it would be a good time to talk about all the ways that your GP can help you keep healthy this year through preventative health. So I wanted to talk about screening tests today, what to screen for, when, and a little about the rationale behind them. For instance, the newish cervical screening test, there's still some confusion about that. Ovarian cancer screening, there is still confusion about that as well. When I see a patient, one of the things I try to do during each visit is to see if they're up to date on their screening tests. But some visits are really complex, and we can spend the entire appointment on one issue, and sometimes the preventative stuff can get missed out on. So if you're someone who never gets to the doctor, or your appointments have been quite complex, you may be missing out. So it's good to have an idea of what's available, what the recommendations are, so you know when and how often, and the reasoning behind it, so you can make informed decisions about your participation in screening programs. So let's jump in. Now, I mentioned the cervical screening test, so let's just start with that one. Now, in the old days, that would be 2017 and before, not so long ago, we did the old pap smear test, which meant a speculum exam, where a speculum is inserted into the vagina and it's opened so the cervix can be visualized. And then some cells were brushed off of the cervix and smeared onto a slide. The slide would then go to the lab, where they would look for changes that may indicate that cervical cancer was developing. The reason we had to do that test every 2 years was because it had a high false negative rate, meaning at one test, everything could look totally normal, and then 2 short years later, a woman has high-grade changes. Essentially, what we were looking for is evidence that the human papillomavirus, HPV, had been there and had started causing changes in the cells that could lead to cervical cancer. So HPV is a virus that we know is responsible for almost all cervical cancers, and that it can live dormant in the body for many years. And once it starts affecting the cells, it does so in a predictable pattern. And it takes a good 10 years for those changes to then become cervical cancer. So the new test is a swab, like a COVID swab, looking for the HPV virus in the vagina. And if it's not there, then we know we can safely wait another 5 years to look for it again. So not only did the test change from an invasive speculum exam to a swab that a woman can now do herself if she chooses, but now, instead of every 2 years, it's done every 5 years. When the changes were first made, a lot of women were concerned about doing the swab themselves because they were worried they wouldn't get it right. So explaining to them it's just a simple swab test like a COVID swab up the nose, just in this case, it's not in the nose. Most women are pretty happy to collect it themselves. It really is difficult to stuff it up, though I will say I have had a few women put the swab in the urethra, which is where the urine comes out. This is very uncomfortable. So I tell my patients if there's uncomfortable resistance when trying to insert the swab, just pull it out and try again. The test should not be painful. It's not nice, but because of where it's going, but it shouldn't hurt. So if it hurts, you're likely trying to put it into the urethra. So once the swab is done, it's sent to the lab to look for HPV. If it's negative, great. You're off the hook for another 5 years unless you have concerning symptoms in the meantime, which I'm going to talk a little bit more about in a second. If the test does return positive for HPV, then it depends on which strain it is to determine what we do next. So like COVID, HPV has multiple different strains. There are 2 particularly nasty ones, HPV 16 and HPV 18. Those 2 are responsible for a good majority of cervical cancer. So we don't mess around with these guys. If you have one of these, you get referred straight to the gynecologist where they do some more special tests of the cervix and possibly take a biopsy to see if it's just low-grade changes or more than that. The beauty of this screening test is if you have low-grade changes, the cervix can be monitored regularly to see if your body is able to clear the virus and keep these low-grade changes from getting any worse. It's just a virus, so your body should eventually get rid of it. We just need to make sure that we're ready to take further action if it starts getting ahead of us. So if high-grade changes develop, then the gynecologist can do a procedure to remove those cells so they don't become cancerous. Now, if you have one of the other less worrisome HPV strains, we just call these HPV other, then the GP can get you back, do the speculum exam, have a look at the cervix, and collect some cells to have a look and see if there are any changes being made, and then the same thing. If everything looks normal to low-grade changes, we can just give your body a bit of time to do its thing and get you back in 12 months, do all of it all over again to see if the body has cleared it or if there has been any further changes. Again, we know that HPV works in a predictable way, so we now have the luxury of detecting it when it's there and then keeping a close eye on it while allowing the body to do its job. And if it looks like it's getting ahead of us, then we can act. Now, there are times when a woman shouldn't have a self-collected swab, and we should just jump straight to the speculum exam, have a look at the cervix, and collect some cells as well as do an HPV test. And that is if you have concerning symptoms. Concerning symptoms would be things like pelvic pain or pressure and or abnormal bleeding. So any bleeding in between periods, after intercourse, or any bleeding after menopause. In those cases, then we really need to have a closer look and see what's going on. Cervical screening in Australia starts now from the age of 25, and it finishes between the ages of 70 and 75. I think it's also important to point out here that cervical screening is really only looking for changes to the cervix. Some people think it's screening for uterine or ovarian cancers, but it is not. It is only looking at the cervix, which is the opening to the uterus or the womb where the baby comes out if you have a baby by a normal delivery. Unfortunately, we do not have any screening tests for endometrial or ovarian cancer. I wanted to take a second here because this one usually causes a bit of controversy. In 2024, 1,805 women were diagnosed with ovarian and fallopian tube cancers in Australia, and the main risk factor for ovarian cancer is getting older. It is most commonly diagnosed in women who are over the age of 50. It can be a really tricky one to diagnose, especially in the early stages, because the symptoms can be so vague and hard to pick. So even though ovarian cancer is only the 10th most common cancer in women in Australia, it is the 6th leading cause of cancer death because it is usually only found in those late stages. So I just wanted to go over some of the symptoms to be on the lookout for. Abdominal bloating, difficulty eating or feeling full quickly, frequent or urgent urination, back, abdominal, or pelvic pain, new constipation, menstrual irregularities, fatigue, indigestion, or pain during sexual intercourse. So as you can see, these symptoms are all very vague and they can be related to lots of other more common, less serious health problems. And most of us are going to have all of these symptoms at some point. But if you're concerned, if they're unusual for you, or if they're persistent, or they seem to be getting worse, please have the discussion with your doctor and the two of you can decide whether it needs investigation. So this is probably a good point to make the difference between screening for something or investigating something. When we talk about screening for illness, we are talking about asymptomatic people, so people who do not have symptoms. If you have concerning symptoms, then we need to investigate, not just screen. So for instance, with the cervical screening test we just spoke about, if you have abnormal bleeding, we have a look and take some cells. We don't just screen for the virus. We don't just do the swab. If you have concerning symptoms for ovarian cancer, then we will do an ultrasound and further investigations depending on what turns up, which brings me to the CA-125 blood test. From time to time, the news will report on it, or it'll be put into an article that we can screen for ovarian cancer by using this blood test, the CA-125. So I just wanted to take a quick second to explain this. The CA-125 is a protein found in the blood, and it can be produced by ovarian cancer cells, but there are a lot of other causes for raised CA-125 levels as well. Things like menstruation, endometriosis, or even ovarian cysts. And half of all women who do have early stage ovarian cancer don't have elevated CA-125 levels. So we just don't use it as a screening tool. In fact, I have seen women for whom this test has been used inappropriately, and they've been put through a lot of unnecessary stress and anxiety looking for something that was never there to start with. Now, if a woman does have concerning symptoms, generally an ultrasound is done to look at the ovaries and the uterus. And if something's found there, like an unusual cystic structure on the ovary, then a CA-125 is done to give us more information about what's going on. If a woman has a high risk of ovarian cancer, so she has a family history of ovarian cancer, in Australia, if she doesn't have symptoms, there still isn't any recommended screening tests. There will certainly be a lower threshold for investigation if she has any symptoms. So if this is you, be sure that you alert the doctor you're seeing to your family history and your concerns if you have symptoms you're worried about. Okay, so let's now move on to the other big screening test for women, and that is for breast cancer screening. In Australia, routine screening starts at the age of 50 and it stops at 74. We have a traveling mammogram bus that comes around every year, and from 50, you'll start getting invited in for your mammogram. You can, though, invite yourself from the age of 40, and you can continue to invite yourself after the age of 74, and it's still free of charge. Screening is generally done every 2 years if a woman is at average to slightly higher risk. So what's considered average to slightly higher risk? Well, a woman's considered average to slightly higher risk if she has no known family history of breast cancer or only a small amount of family history, such as relatives diagnosed when they were older, so over 50, or any age but distant relatives, so not mom, dad, brother, or sister. If a woman's considered to be moderately increased risk, then it's generally recommended she have mammograms yearly starting at the age of 40. A woman is considered at moderately increased risk if she has a strong pattern of breast cancer in the family, like a close relative diagnosed before the age of 50, so mom, dad, brother, sister, or two close relatives on the same side of the family with breast cancer, or two or more distant relatives, one of which was under the age of 50. So this category has a stronger family history, but not the known high-risk variants in genes like BRCA1 and BRCA2. A woman is considered at high or potentially high risk when there's a strong pattern of breast and or ovarian cancer in the family, especially when cancers were diagnosed at younger ages. There were multiple relatives on the same side of the family, or in situations linked to inherited gene changes. This would include families with cancers diagnosed before the age of 40, having cancer in both breast and ovarian cancer in the same person, a male relative with breast cancer, being of Ashkenazi Jewish ancestry, or having a known gene mutation like BRCA1 or BRCA2. Women at high risk are usually under the care of a specialist who may do annual examination and imaging, which might include MRI screening. If you're not sure what category you fit into, there is a handy little calculator called I Prevent on the Peter Mac website for the Peter MacCallum Cancer Centre, and it's endorsed by my college, the Royal Australian College of General Practitioners. It says it takes about 30 minutes to complete it, but it really took me a lot less time to do that for myself, and it gives you a report at the end that you can take to your GP for discussion. I'll leave a link in the show notes. Now, again, it is important to point out the difference between the screening and investigating. We don't want you rocking up for a screening mammogram if you've got a concerning symptoms. This happens all the time, and the GP should get a letter to say that you did report a symptom. So that really does need to be followed up with your GP if you went ahead with the screening mammogram even though you had a symptom. We take breast changes very seriously, and they really need to be discussed with your doctor so a full history can be taken along with an examination and then most likely a mammogram and a targeted ultrasound. There was a time when I first trained all those years ago that I did a breast exam at the time of every pap smear, and I even offered an internal exam to check the ovaries. But those things are no longer recommended as part of the routine practice because they weren't found to help reduce morbidity or mortality. So they weren't helping women live longer or reduce the risk of serious illness from these cancers, so they aren't routinely done. But again, if there's a concerning symptom, then an examination is really important. Now, in terms of breast exams, the recommendation is that women are familiar with their own breasts. A lot of women tell me they don't do self-checks because they don't know what they're looking for. And I think the biggest value is knowing what your breasts normally feel like, what your normal lumpiness feels like. So if something new develops, you're more likely to pick it up. The best time to check your breasts are the week after a period when they're least lumpy and least tender. And what you're looking for is a new lump or lumpiness, especially if it's only in one breast, a change in the size or shape of the breast, a change in the nipple, like any crusting or ulcers, redness, or inversion of the nipple, that's new, a nipple discharge that happens without squeezing the nipple, a change in the skin of the breast, like redness or dimpling, or any unusual pain that doesn't go away. Now, it's important to remember that 9 out of 10 breast changes are not due to cancer. But it is important to see your doctor just to be sure if you do find a breast change that is unusual for you. All right, let's move on to bowel screening. In Australia, our national bowel screening program has changed in this past year from screening those at average risk of bowel cancer starting at 50 years old to now starting at 45 years old. And we do this with a fecal occult blood test, which I'm going to talk more about in a second. The screening is recommended every 2 years, and it stops at the age of 74. Now, the age that we start screening has been lowered from 50 to 45 because there's been an increase in the incidence of early onset colorectal cancers. So bowel cancer occurring before the age of 50. We're not exactly sure why yet, but one theory is that it's related to our Western diet, obesity, tobacco use, and alcohol intake, and how these things affect our gut microbiome and cause chronic inflammation. By the way, if you haven't listened to my How to Have a Happy Gut episode, I do think it's well worth a listen. Now, colorectal cancer is the 4th most common type of cancer in Australia, but the 2nd leading cause of cancer death. But we know that the earlier we can identify it, the better the prognosis is, especially if it's just a little polyp that hasn't even turned into a cancer yet. The idea behind the screening program is to catch bowel cancer very early, or again, even catch it in that precancerous stage when it's just a little polyp. The great news is that if we do catch it early, over 90% of bowel cancers can be successfully treated. The bad news is that the uptake of the national screening program is not as good as it could be. Only about 42% of us are actually doing it. I think a lot of people just forget about it. So I'm hoping that this discussion today will act as a reminder. A lot of trouble can be saved by catching bowel cancer in these early stages, not to mention may just save your life. So what's a screening kit and how does it work? Bowel cancer often develops without any symptoms, and it can grow in the bowel for years before spreading to other parts of the body. Very small amounts of blood can leak from these little growths and pass into your feces. These tiny amounts of blood can be wrapped up in the feces so you don't even see them just by looking at it. And that's where the screening comes in. The bowel screening test is an immunochemical fecal occult blood test, FOBT. It can detect tiny amounts of blood in your stool that can be a sign of cancer. You just need to collect 2 tiny samples from 2 different stools. The kit you get from the program is super easy to use. In the old days, and even still with the kits that we give from the clinic, we have patients open their bowels into a container that they can get rid of afterwards, after they take the sample, which is just by sticking this little brush into the feces. But the kits you get from the National Bowel Screening Program come with this toilet liner paper you just put down on the water in the toilet, and then you just flush it down after you've taken the sample, which again just involves dragging this little stick attached to a handle, which is actually the lid of the container, dragging this through the feces, then putting the lid back on the container. It's that easy, and you don't have to touch anything gross. And did I mention it could save your life? Now, a couple helpful tips to getting it done would be to keep the kit in the bathroom. I put mine right next to the toilet as a reminder. Another would be to set a date and put a reminder in your phone that goes off every day until you do it. And then only remove that reminder when it's done. And remember, it really is so easy, guys. I personally know someone who was so busy looking after everyone else and just never got around to doing their own personal kit. They ended up with bowel cancer, which was diagnosed from having some pain. And then they had a good couple of years of operations and chemotherapy, a lot of pain, discomfort, major inconvenience, and not to mention fear and anxiety about what was going to happen. When if this person had done their kit, who knows? It could have just been a little polyp waiting to go off. It could have saved them a lot of trouble. So ladies, let this be your reminder. Now, I have had some people tell me they haven't done the test because they don't have symptoms and they feel fine. Again, this is a screening test to catch things before they become a real problem. And again, if you do have symptoms, that you'll need investigation, not just screening. It's important to know that not all bowel cancers are going to show symptoms. And just because you have symptoms, it doesn't mean you have bowel cancer. But here are a few symptoms you do need to let your doctor know about in case you need to go right to the next step. Instead of having a bowel screen, going straight to a colonoscopy where a camera is put into the bowel to have a look around. So if you have bleeding from the rectum or any sign of blood after a bowel motion, a change in usual bowel habits like new constipation or diarrhea and it's persistent over several weeks, unexplained abdominal pain or bloating, weight loss for no obvious reason or a loss of appetite, symptoms of anemia like unexplained tiredness, weakness, or breathlessness. We are all at risk of developing bowel cancer, especially as we age. But here are a few other things that can increase your risk. A previous history of polyps in the bowel, a previous history of bowel cancer, chronic inflammatory bowel disease like Crohn's disease, a strong family history of bowel cancer, increased insulin levels, or type 2 diabetes. For people who are at increased risk of bowel cancer, they'll likely have some other plan in place for screening, which most likely will include colonoscopy. So you're considered high risk if you have one first-degree relative diagnosed with bowel cancer before the age of 60. So again, that's mom, dad, brother, or sister. Or you have 2 first-degree relatives diagnosed at any age. Or you have 1 first-degree relative and 1 or more second-degree relatives diagnosed at any age. For these people, colonoscopy should be offered every 5 years, starting at 10 years younger than the earliest age of diagnosis of bowel cancer in a first-degree relative, or at the age of 50, whichever's earlier. And again, this continues every 5 years until the age of 74. You're at very high risk if you have 2 first-degree relatives and 1 second-degree relative with bowel cancer, with at least 1 diagnosed before the age of 50, or you have 3 or more first-degree relatives diagnosed at any age, or you have 2 first-degree relatives and 2 or more second-degree relatives diagnosed at any age. For very high-risk people, colonoscopy should be offered every 5 years, starting at 10 years younger than the earliest age of diagnosis of bowel cancer in a first-degree relative, or at age 40, whichever is going to be earlier. And again, this happens every 5 years to the age of 74. And if not done yet, these people really should be referred for genetic testing. Okay, last one. This one's going to be a bit brief, but I wanted to mention it because it's a new one that not many people know about. And in fact, this is the first new screening test we've had in the last 20 years in Australia. It's the lung cancer screening program. Lung cancer is the 5th most common cancer in Australia, but it is the leading cause of cancer death. The screening program is for high-risk people between the ages of 50 and 70 who have a smoking history. So they're either still smoking or they've stopped smoking in the last 10 years. And again, it's a screening test, so they can't have any concerning symptoms. The screening's done with a CT scan of the lungs, and then it gets repeated every 2 years or sooner if something's found on the scan that needs to be monitored. There are a few little caveats to this screening program, so if you're a smoker or you've just stopped smoking in the last 10 years or you know someone else who is, then I'd encourage you to have a discussion with your doctor. All right, guys, I think that one was a little bit lengthy, but I hope you've learned some things. And if you aren't up to date with your screening, hopefully this has inspired you to book it in and get it done. If you did get a bowel screening kit and it did expire and you never did it, it's super easy to get online and just order another one or give them a ring and they'll send you one. So hopefully, guys, you'll get it done. Now, if there are any other topics you're keen to hear more about this year, please send me an email and let me know. Even if it's just a quick little comment about how you found an episode. I find those really fun to read. And I do read every one of my emails. The podcast grew enormously this past year, and I'm really excited to see how much more we can grow it this year. So if you can think of someone who might get something from this episode, please share it. Just to let you know, you guys are doing an amazing job. This podcast was shared more than 96% of other podcasts. So thank you, guys. Thank you for listening, and thank you for sharing and getting this information that I just really think is so important out to all of the other women in your life. I wish you all a healthy and prosperous new year. I hope you're as excited as I am to see what the year ahead brings us all. Have a great week, everybody. And until then, I hope you opt to thrive.
The Opt to Thrive podcast is designed for information purposes only and is not engaged in the giving of medical advice. The information provided on the podcast should not be used for diagnosing or treating a health problem or disease. In no way should the information provided by Opt to Thrive be considered medical advice, and at all times the advice of a medical professional should supersede recommendations from Opt to Thrive. If you have or suspect you may have a health problem, you should consult your healthcare provider. The views expressed in this podcast are purely that of Dr. Sim and do not in any way reflect those of the institutions she contracts her medical services to.
Thank you for listening to Opt to Thrive. If you've enjoyed listening, please rate and share the podcast. You can visit our website at opttothrive.com and leave a comment for any subjects you would like to hear more about.